Meet Joe. Joe has been serving time for a drug-related charge and is about to be released on parole. While he is excited, Joe has a lot to figure out in order to live a stable life once he is free. Joe's parole officer told him about a program called Pathfinder, which would pair him with a community care coordinator, who is basically an expert at navigating services and resources that could help Joe succeed after he leaves jail. Before he is released, Joe meets with his community care coordinator, Kathy, who asks him a long list of questions to learn more about the support he needs. This isn't Joe's first time in jail, and he tells Kathy about some of the struggles he had after he was last released. The medicine Joe received in jail for his mental illness really helped control his mood swings, but without health insurance or a car, he couldn't stay on top of filling his prescriptions. Joe couldn't find an apartment that would accept him with his criminal record, so he bounced around on couches. He searched for a job, but because he had never graduated high school, he kept getting turned away. Life started to feel very unstable, and soon Joe was using again. Now that Kathy knows what sort of things are putting Joe at risk, they work together to make a plan that will knock down the obstacles to Joe's success. Kathy will support Joe and hold him accountable along the way. First, Kathy gets Joe signed up for health insurance and finds a clinic nearby that can serve as his new medical home. She makes sure his health records are sent to the new doctor and schedules an appointment for him right away. Kathy checks in with Joe regularly to make sure he is attending his behavioral health appointments and staying on top of his prescriptions. She even offers to drive him to appointments when he can't arrange a ride of his own. For now, Joe is staying with family, but he wants a stable home of his own. Kathy helps Joe submit an application for an affordable housing unit and gives Joe regular updates on the status of his application. Joe had lost track of his social security card, and his ID expired, so Kathy helps him track down these important documents that he'll need to apply for jobs. Kathy schedules Joe an interview with a program that specializes in finding employment for ex-offenders. Joe never finished high school, so Kathy talks to him about an evening GED program at the library that would work well with his schedule. Kathy got him all signed up and calls him regularly to see how class is going. Thanks to support and encouragement from Kathy, Joe is on a path to a more stable life. Joe's commitment to take charge of his health will make it far less likely that he will reoffend. Kathy will keep working with Joe until all of the barriers to his success are removed and he is ready to live a healthy and independent life.